Hello, everyone. My name is Susan Pereira, and welcome to Heartland Health Center's Facebook Live event on Pap Smear Mammogram screening. I am the Reproductive Health Nurse Manager at Heartland Health Centers. And quick disclaimer before we get started, just to let you know that the information provided in this event is not a substitute for professional medical advice. All content and information is for general purposes only. You are encouraged to discuss any information obtained from this event with your healthcare provider. Now, if everyone else can introduce themselves, I'll turn it over to Ann Terracone.
Hi, I'm Ann Terracone. I am the Breast Health Navigator at Heartland Health Centers.
And Lauren.
Hi, my name is Lauren Hayes. I'm a certified nurse midwife. I work with the Advocate Midwifery Group. I'm one of 8 midwives with that group, and I care for people at Heartland Health Centers along with some clinics with Advocate. So I can see you for prenatal care during your pregnancy. I can be there when you give birth at the hospital. And then I also just care for people across their reproductive lifespan. So if you need an annual exam, Pap smears, or if you have any gynecological issues, you can come see me.
Wonderful. Linda?
Hi, my name is Linda Smith. I am also a certified nurse midwife. I work with Lauren as well, a part of the 8 midwives in our group. I also deliver babies at Illinois Masonic Medical Center, and I also work for Advocate clinics, 2 Advocate clinics, as well as Heartland Health Center Wilson location. I provide prenatal care, reproductive health screenings and care. And yeah, come see us.
Great. Thank you so much for participating in this event. I think we'll start with some Pap smear questions. And the first question is, can you explain what a Pap smear is? Linda.
Yeah, so a Pap smear is a test that's used to detect cellular changes or strains of HPV that may predispose a person to cervical cancer.
Great. Next, I'd like to know, why is it important to get a Pap smear?
Yes, so Pap smears are important because they can help with the early detection of abnormal cervical cells, as well as identify precancerous and cancerous cells. So, by identifying these cellular changes earlier, we are able to monitor the cervical cells over time and potentially remove them before they have a chance to become precancerous or cancerous. Or if you were identified as having cervical cancer, then we'd be able to, discuss treatment options and a plan going forward.
Great, thank you. And how often does a person need a Pap smear?
So Pap smears are not indicated or needed for people under the age of 21 unless they are immunocompromised with conditions such as HIV. But the normal age to begin Pap smears is 21. So those that are between the ages of 21 to 29 should be screened, should have a Pap smear every 3 years. And that's without a co-test, meaning we do not automatically test for HPV. Unless there's a reason to. Those that are 30 to 64 should have a Pap smear done every 5 years, and that's with co-testing, meaning we are looking for the HPV, human papillomavirus, along with the Pap smear screening. Those that are 65 and older no longer need a Pap smear as long as they have a negative history, meaning they have never had any high-risk HPV or have never had cervical cancer. They are good to stop having Pap smears. Those people that have had a hysterectomy with the cervix removed and no prior history of abnormal Pap smears are able to stop having Pap smears as well.
Great. And then Lauren, does a Pap smear hurt? And can you maybe explain how you would try to decrease the comfort level when you do a Pap smear?
Sure. So ideally, a pelvic exam and a Pap smear would never be painful. But in order to do a Pap smear, we do need to insert a speculum into the vagina. And so this is what, sorry, let me make sure you can see this. This is what a speculum looks like. We have different sizes depending on your size and your history that we can use. So it will be lubricated with either a little bit of gel or water that will help ease insertion. And once the speculum is inserted, I will actually point out too that this is a disposable speculum. There are also some that are metal and reusable, but they, look very similar. So this is a diagram of a vagina, a uterus, and the cervix is, if you can see that.
Yeah, we can see that.
For the vagina. So we would insert the speculum into the vagina, and to open it, you'll hear a couple clicks. And what that does is it separates the vaginal walls so that the cervix at the back of the vagina can come into view. Once the cervix is in view, there is a brush. One looks like this. Also, if you've ever done your eyebrows before with an eyebrow pencil, or if you've seen that, there is a little brush located at the end of that. That's another type of brush that might be used. I didn't have one available today to show you. But this will be passed through the speculum to the cervix and turned. We then, remove that, insert it into a solution and remove the speculum. So again, ideally, this would never be painful, but I mean, I think we all recognize that this is an intimate exam. It makes people feel vulnerable. That increases, people's anxiety. It can heighten your sense of pressure or discomfort. So, you may, again, feel pressure or discomfort, but I just really want to stress that it's your body. You're in control of the exam that's happening. If at any point you need us to pause, you can say that, or to stop the exam, we can do that. So I just think it's really important that, you're comfortable with your provider and that you feel like you can speak up if you need someone to stop.
Thank you. That's very important. Linda, can you explain HPV a little bit more, maybe in kind of layman's terms, because I know that can get complicated.
Yes. So HPV, which is the human papillomavirus, it is a DNA virus, and it is actually the most common sexually transmitted infection. And there are over 150 types of HPV out there, with 15 of those strains that may lead to cervical cancer. So some forms of HPV can cause general health problems, genital warts, or cancers. Most people with HPV are asymptomatic, meaning they do not have any symptoms, and therefore when they are being intimate with someone, they may pass along that virus without themselves having any signs or symptoms. So that's important to remember, because it makes it difficult to be able to detect when you may have actually been exposed to the virus. HPV can be passed through sex, which can be anal, oral, or vaginal sex. It can also be passed through close skin-to-skin contact during sex. Sorry. Sorry, that's pretty much it.
Yeah, that's great. That's really great. A little later, we'll maybe talk about the vaccine and that kind of stuff. But Lauren, I think you already showed us where the cervix is. I think that was pretty clear. Is there anything else you want to say about the cervix? Or
so it's just the lowest part of the uterus. It's cylinder shaped, kind of feels like the tip of your nose. It's the same consistency. It's located in the back of the vagina, so it kind of connects basically the uterus to the vagina, and it's the opening to the uterus. I forgot to mention before, with discomfort during the Paps, that when we collect the cells for the Pap, it might feel a little scratchy or pinchy.
Okay, yeah, that's good to know. Sometimes do people get a little bit of bleeding maybe after a Pap?
Cervix is sensitive to touch, so it's normal if you have a little bit of spotting after a Pap smear.
So nothing to be worried about then, right? Okay. And Linda, back to kind of like HPV, what can a person do to prevent abnormal Paps, and then explain the HPV vaccine to us?
Sure. So the first thing a person can do to prevent an abnormal Pap smear would be to get vaccinated against the HPV virus. Also, practicing safe sex, wearing a condom, minimizing the amount of sexual partners that you have, and getting regular checkups and regular Pap smears are ways that you can prevent an abnormal Pap smear. As far as the HPV vaccine, it has been, is usually given between the ages of 11 and 12, but a child can also get the vaccine as early as 9 years old. And so the vaccine protects against the high strains of HPV, which are 16 and 18, which have the potential to, the vaccine has a potential to prevent more than 90% of cancers that may be attributed to the HPV virus. So if a person gets the vaccine at their 15th birthday or beyond until age 26, there's a 3-dose series. I'm gonna go back because I forgot to mention the 11 and 12-year-old. The dosage, the regimen is a 2-dose regimen. So after their first vaccine, they'll come back 6 to 12 months later for the second dose. For those that are between the ages of 15 and 26, they would get the 3 doses of the vaccine. So after the first dose, they'll come back 1 to 2 months, and then the third dose will be given 6 months after the second dose was given. Those that are ages 27 to 45 can get the vaccine. Basically, it's based on an individual basis. So those that would be recommended to get the vaccine are those that have never had any sexual contact or have limited sexual contact, or those people that may be exposed to the HPV virus by having a new sexual partner.
Okay, got it. Just to clarify too, men and boys can get the vaccine, right?
Yes.
Okay, wonderful. And then for those over 27, just to check with your insurance about the vaccine coverage.
Yes.
That's just from my experience. And then moving on, if someone has an abnormal Pap, Lauren, does it mean that they're going to get cervical cancer?
No, an abnormal Pap, it does not mean that you have cervical cancer or that you will go on to develop it. Abnormal Paps are actually fairly common, and usually with time, your body will clear, if it's related to HPV, which usually it is, will clear that infection, and then with time, you'll have a normal result. But by having an abnormal Pap result, we're able to then, make recommendations for monitoring and make sure that these cells don't change any further. And if they were to have any further change, it's possible, we might recommend removal of cells, which would then prevent them from turning into precancerous or cancerous cells.
Okay, and then just tagging right onto that, regarding removal of cells or diagnosing abnormal cells, can you, Linda, explain the colposcopy and LEAP procedure if needed?
Yeah, so a colposcopy is the primary diagnostic method that's used to determine if a person has precancerous or cancerous cells. So a colposcopy is a microscope that's used to look inside of the cervix, and they're looking for the abnormal cells. And those cells are then taken, they're biopsied, they're sent to the lab to be tested, and if they come back as precancerous or cancerous cells, then that person will go on to have a LEAP procedure. And the LEAP procedure is, it stands for Loop Electrosurgical Excision Procedure, and that's when they remove the precancerous or cancerous cells from the cervix.
Okay, great. And just to let people know, the colposcopy and the LEAP are done in the office. And we do them at Heartland Health Centers. And we'll get into how to make an appointment in a minute too, which is important. I'm going to skip the next question because Linda already told us when people need to start getting Pap smears and when they stop getting Paps. So moving on.
That any person with a cervix should start screening at 21.
Okay, wonderful. And so can we just move on to another question? Do transgender men need Paps?
Yes, transgender men do need Paps. They are at risk for cervical cancer. And unfortunately, there is inadequate screening for cervical cancer because it's been linked to barriers in transgender individuals when they're trying to face, they're having barriers in with getting culturally sensitive care. So unfortunately, that is a reason why public exams are not are not happening as much in that community. But it is important to remember that any person with a cervix should have a Pap smear. And they're more than welcome at Heartland Health Center.
Or Advocate, right? Advocate,
Advocate,
Illinois Masonic. Speaking of Heartland Health Centers and Advocate, Illinois Masonic, Lauren, how can a person get a Pap smear at Heartland Health Centers or at your facility?
Yeah, so you can call to schedule an appointment at any of our primary care clinics with Heartland, and that phone number is 773-751-7800. And again, we also see patients through advocates. Our phone number there to schedule is 773-296-7032, and you would choose option 2.
Very good. And we'll have someone put that information in the chat so everyone can access that as well. And then Linda, if a person doesn't have insurance, is there a place they can get a Pap smear?
Yeah, so at Heartland Health Center's Wilson location, they offer free or low cost reproductive health care, which includes Pap smears, and that's through the Illinois Family Planning Program. And once again, the number to call is 773-751-7800 to schedule an appointment.
Great. And that's at the Wilson Clinic at 845 West Wilson. And the Illinois Family Planning Program used to be called Title 10 for folks out there who are familiar with that. So please give us a call to schedule an appointment. Is there anything I missed about the Pap screening that you all want to say? Or if not, we can move on to the mammogram questions. And looking in the chat, I don't see any questions in the chat.
There is something that I wanted to add. I'm sorry.
Yes, go ahead.
The timing of the Pap smears of when to stop. Those that are 65 and older, if they have had a history of high risk, either precancerous cells or HPV, then they should continue treatment for at least 25 years, after.
After the,
yeah.
And if, I can't remember if we mentioned this, but if a patient had a hysterectomy for cancer, they do need to continue having Pap smears, correct?
Yes.
Right.
It would be like HPV-based testing. It's done yearly after having the hysterectomy for 3 years. So yearly for 3 years, followed by usually about every 3 years HPV testing, again, depending on what the results in your history is.
Wonderful. Okay, great. Okay, moving on, we're going to talk about mammogram screening.
Yeah, thank you all. That was super informative about Pap smears. So I have some mammogram questions. My first question is, what is a mammogram? Can you describe that, Linda?
Yeah, so a mammogram is an X-ray picture of the breast, and it's used to screen for early signs of breast cancer.
Cool, thank you. Lauren, why is getting a mammogram important?
So, regular mammograms are one of the most important things that you can do for your health and to reduce the risk of breast cancer related risks. They help identify cancer early. Mammograms really do save lives. They can identify a nodule or a lump that you may not be able to feel yourself or that a provider can't feel. And I think, we all know that early detection of breast cancer is, critical for having a better chance at recovery and for having more treatment options.
Cool, thank you. So how regularly should someone be getting a mammogram? And what if they have like a family history of breast cancer?
So there isn't just one set guideline or recommendation for when you should start mammograms. If you are somebody who knows that they have a gene mutation, such as the breast cancer 1 and 2 gene mutations, then screening can start as early as age 25. And it's typically with mammogram and MRI. If you do not have that history, if you're at average risk, then screening can really start anywhere between age 40 and 50. It can be every year or it could be every 2 years. So when you start and the frequency of your screening will depend on your health history. If you know your family's health history, that's helpful. Because you and your provider will talk, and based off of your history, your family's history, you both will come to a decision on when it's best for you to start. So there's also, some risks of screening. So that would be, sorry, let me pull it up because there's a few. So there can be false positive screens. It can lead to unnecessary imaging, unneeded surgery, discomfort, pain, or anxiety. So again, you have to weigh those risks versus the benefits of identifying cancerous lumps or lesions early, which will give you better treatment options. Sorry, I had another thought I wanted to add in.
Do you want to talk a bit about breast self-exams and if people should be doing those?
So, for a long time, it was recommended that people perform exams monthly, but it's very normal for your breast tissue to change throughout the month due to your cycle and your hormones associated with it. So because of this, it's no longer recommended that you have to do monthly self-exams. Because you may identify like normal changes in your breast that can lead to unnecessary imaging or procedures. But what is recommended is that you meet with a provider yearly and that you have at least one clinical breast exam.
Thank you. Linda, what does it mean if I'm asked to come back for additional screening or additional imaging?
So it means that they found something that looks abnormal that they just want to do a little bit more imaging, so maybe more mammograms or a breast ultrasound, but it does not mean that you have breast cancer.
Okay, thank you. And can someone get a breast ultrasound instead of a mammogram for their screening?
Yeah, so there may be situations where your provider thinks that you need a breast ultrasound. Usually it's not in place of a mammogram. A mammogram is still considered like the gold standard for screening. But some people, who have really dense breasts, they may need both a mammogram and an ultrasound, or some people who have had chest implants, if they're having a difficulty getting clear imaging on the mammogram, they might need an ultrasound as well.
Great, thank you. And if someone doesn't have a family history of breast cancer, do they still need to get these screenings annually or regularly?
So yes, they do. And that's because average risk people have about a 15% chance of developing breast cancer. And which age is used to determine when you would screen for breast cancer. And the chances of developing breast cancer increases with age. So it is important to get regular screenings.
Okay, thank you. And so how should someone prepare for a mammogram appointment? Is there something they should or shouldn't do when they finally get that appointment?
Yeah, so if you are going to have your mammogram so if you've had a previous mammogram or previous imaging done elsewhere, then it's beneficial if you obtain your records and the images, either have them sent to the facility or bring them with you the day of so that the radiologist can compare. And then also day of, it's important to not apply any deodorant to your underarms, don't apply any powders or creams to your underarm or chest. It's possible that those products have, something in them that might show up as like a white spot on the mammogram, which can, make it a little bit difficult to determine what that is.
Yeah, that's good to know about the deodorant. I think everyone has this question about mammograms. Do mammograms hurt?
So everyone's pain tolerance is different. Mammograms may cause discomfort, but it is important. It's really brief. So, if you are experiencing a little discomfort, it should be over soon, quickly.
Okay, good to know. Thank you. And if someone doesn't have insurance, is there a place that they can get a free or low cost mammogram?
Yes. So through a program with Swedish and St. Francis, Heartland can refer patients for free mammograms. And this also includes any follow-up if needed. So what you would want to do is schedule an appointment with a primary care provider at Heartland. So again, that number is 773-751-7800. And then I also want to add in that you can also get free or low cost reproductive health care, which includes the mammogram referrals through the Illinois Family Planning Program at Heartland and at our Wilson Clinic. And that's the same number, the 773-751-7800 to schedule.
Great, thank you. My next question for Linda, does an abnormal mammogram, I guess you already answered this, does an abnormal mammogram mean that you have breast cancer?
Right, no.
Great, thank you. And my last question, what are the guidelines for trans men and trans women for getting screenings?
So transgender men who have chest tissue should follow the same screening guidelines as cisgender women. People who have had top surgery or chest reconstructive surgery likely do not require mammograms. And current data doesn't support annual clinical chest exams either. Unless you're having symptoms, then you may need one. For individuals who have had a chest reduction and some chest tissue still remains, then you should have mammograms, and the timing or frequency will be based off of your health history and your talk with your provider. And then for people who are taking feminizing hormones and have been taking them for more than 5 years, it's recommended that they have mammograms every 1 to 2 years.
That's really good to know. Thank you.
Mhm.
Are there any questions in the chat, Amanda, or is there anything that we missed?
I think what I was trying to think of when I was talking about the frequency of screening are the risk factors. So if you have a strong family history of breast cancer, and this would mean, typically that you have first degree relatives, so either like a mom, a sister, if you have a child who has breast cancer, and they've had it before age 50, then that increases your risk of developing breast cancer. Or if you have, and sorry, this would be a history of breast cancer or ovarian cancer. Or if you have 2 or more other family members who have had these cancers at any age in their life. And again, having a gene mutation like the BRCA gene 1 or 2, that puts you at high risk. And a couple other things that that people can control are if you're a smoker, that increases your risk. If you have obesity, if you don't exercise, those are lifestyle. What's the word? Lifestyle things that you can do, that you can change to help decrease your risk of breast cancer.
Thank you. And it looks like there aren't any questions in the chat right now.
Oh, I think there's one question coming in. Amanda will let us know what it is, but in the meantime, I want to thank you both for joining us. This is such a great and very informative event. Looks like someone's asking, what if you have piercings? So what is the mammogram process? Good question.
I didn't look into that specifically, but I believe you would remove the piercing before you have a mammogram.
Yeah, I think that
We
you would
can
have to, right? We can
post it with our.
Very good question.
A great question.
Yes, that is a great question. So we'll post something just to make sure we're right about that. Any other questions, Amanda? It doesn't look like there are
People who have nipple piercings can, that stimulates the hormone response and stimulates certain hormones. So you might have nipple discharge as well when you have nipple piercings, and that can be normal because of the stimulation of the hormones.
Okay. Looks like there's a question. Hold on. There's a question about pelvic pain, so I'm not sure. Maybe they can clarify.
Yeah, if it's related to pelvic exams or speculum insertion, I would, definitely let your provider know before you start if you've ever had a difficult pelvic exam or if you're worried about experiencing pain. There are, different things that we can do to try to decrease the discomfort. We can try to have you insert the speculum yourself. Or, again, you can have like safe words. I always tell people, like, if you want me to stop moving my hand, say stop. If you want me to remove my hand or the speculum, say out. Just, I think having the talk beforehand too, so that you feel like you know that you are in charge. It's your body, your control of the situation. It's not in that moment, an emergency procedure. It's something that can be stopped. It's something that we can come back to at a later time or later date.
And I, to add to the Pap smear, the comfort of it, I often ask if they would prefer stirrups or leaving them their feet placed on the table. And a lot of times I find that people prefer to just leave their legs on the table and open to the comfort, their own comfort, instead of me putting their feet into a stirrup and, overextending, causing more pain or anything like that. So it's just all about communication, and we are always asking for consent. We are always asking for, this is a shared decision making. So we want to make sure that everyone that's present is comfortable, and this is a very intimate experience and time for a person. So and you're pretty vulnerable when you're on the exam table, and we are aware of that. So we want you to feel as comfortable as you can during that time. So just communicate with your provider and let them know what you would prefer, what you would like, what you dislike, and we are all open to that.
That's great. I think sometimes having a pre-appointment or even like a telehealth appointment just to discuss the process before the actual Pap smear appointment happens is also a nice way to get to know the provider and have some trust, right? Looks like that's all the questions we have. So once again, thank you to everyone for joining today. It was such a fun event. I was happy to do it. Yeah, thank you so much. And I guess we'll sign off now and say goodbye, and hope to have another Facebook Live event soon.
Thank you everyone for joining.
Bye. Thank you.
Bye.